감사합니다. Thank you very much to the committee members and Professor Park for this opportunity. If you look at, even though I'm a spine surgeon and a peripheral nerve, we currently practice here at the largest medical center in the world. We have a 24-hour, 7 days a week stroke program. We got 5 helicopters available to pick up ischemic stroke patients for mechanical thrombectomy or aspiration thrombectomy. But if you understand, there's literally 900,000 stroke patients per year. 85% of that is ischemic. But unfortunately, only the 5% of ischemic stroke patient is benefiting from a thrombectomy procedure, because the neurointerventional capability facility is located at the only major medical center. What about the periphery? If you look at our current practice, Houston, but if you look at the entire size of Texas, as I can tell you, only the 5% of all ischemic stroke patients are currently able to arrive a major medical center with the neurointerventional capability. For that reason, there's 95% of ischemic stroke patients cannot get a benefit from this procedure at all. And that is a unmet clinical need that we need to address. And that's what motivated us to develop what we call world first steerable micro guide wire. If you look at every guide wire currently made by Stryker, Medtronic, Microvention, Terumo, Asahi, all you can do is shake the tip, you push, and you torque. There's no true steerability. So we developed a true steerable tip that's actively controlled on demand. We believe that is extremely important. Number two, in order to address the remote stroke patients, we need an endovascular robot, because only the very few centers can have that capability. And also, in order to be neurointerventional certified, there's only a handful of centers around each state. And that has been our motivation to develop what we consider one of the first neurointerventional robotic system that is coupled with a state-of-the-art actuating micro guide wire. Not only actuates at the tip, but also give you true haptic feedback. This is what every neurointerventionalist wants, some sort of a haptic feedback at the tip of the guide wire to try to minimize that perforation complication that we all worry about. Again, I don't have to tell you, even though you get the patient into our neurointerventional facility, but in order for you to navigate the guide wire and a catheter, microcatheter to the target is extremely time sensitive. We are racing against the time. And this has been a #1 wish list by neurosurgeon or interventional neurologist or interventional neuroradiologist. Can we have a steerable micro guide wire at the tip on demand? And this is our motivation to address this. So if you look at it, and current conventional technique is you're using a multiple pre-shaped catheter to navigate and guide the guide wire. Actually, the guide wire is supposed to be guiding the catheter, but you're using pre-shaped catheter to navigate, guide the guide wire to the target. So I put the slide over here. Some of you may be old enough to understand when you lock your keys inside the car, sometimes you have to use coat hangers to jam it between the door window to open door knob. I'm sure some of the younger doctors, now all the cars has got a sensor built into the key fob, so you never have to worry about locking your keys inside. But I look at my days in the early 70s and 80s and 90s where you lock your keys inside. Constantly you have to shape the coat hanger, jam it between the door window to open the doorknob. And this is the kind of current practice we're doing, trying to pre-shape the tip and using a multiple pre-shaped preformed catheter to redirect the guide wire. And I think this, we all will agree, if we truly have a steerable guide wire at the tip, that will make your life easier and able to get to target as quickly as possible. So, you know, I practice here in Houston, Texas, which is the capital city of chemical petroleum. And when you come to Houston here, we understand the concept of vertical drilling versus directional drilling. The directional drilling is what makes the shale oil fracking and extract the oil. By directional drilling made it possibly. This is why your gasoline price is low as it is now, because the majority of the Canada in northern part of the United States require directional drilling. If you can develop a complex actuating directional drilling, why can we not develop a navigational, steerable, true neuroendovascular system? And that's been, you know, our motivation. But if you look at the guide wire that you use, it's 0.014, and they're so thin, they're so small, and they're 2 meters long. Putting some sort of mechanical control system is impossible to build. So we use what we call electroactive polymer. This is an ionic polymer composite material with electrically integrated that again, on demand, we can actually actuate the predictable degree of bending at the tip. And only the tip is active. The rest of the guide wire is passive. So you can constantly navigate through tiny branches and complex anatomy. I think this is truly the development that, you know, it took us 7 years to develop in our lab, and we're very proud of this system here, which we are ready to demonstrate. This guide wire again is a 0.014 guide wire, which is a 14,000ths of guide wire, most synchro by Stryker, Medtronic, or Microvention, or Telumo side wire, and the tip is a 10,000ths. We can have a pre-shaped to a straight, and this has all the laser cut patterns built in to make it more deflectable, and has a taper core inside to give you that pushability and torqueability that you need. We have a manually connecting system, so you can be driven manually, but you also can attach to our robot that can use as a remotely controlled as well. This system met all the testing requirements and has been submitted to FDA for approval. So we're about 6 to 8 months away from getting this device FDA approved, which we can use it in the United States. So this is what I consider showing you here, making that 90-degree turn on command without using any pre-shaped microcatheter to make that navigation and turn, which you will find it to be extremely, beneficial for your day-to-day practice on a very tortuous, complex neurovascular anatomy. Again, that making the sharp 90-degree turn on demand without using any pre-shaped catheter is what I like to demonstrate for you here on a phantom model. Like I told you before, in order to get FDA approved, we had to get a GLP animal study using swine models, met all the biocompatibility, electromagnetic EMC testing, and packaging, sterilization, and all of the things the FDA is demanding. But what I would like to share with you is that it has all the platinum iridium coil for radial opaqueness. As you can see here, radial marking, because electroactive polymer is radiolucent. So we got platinum iridium double marker that really helps you to see if the tip is straight or tip is bent or curved, which you don't appreciate that with the current guide wire, because you're doing this in two-dimensional real-time fluoro. Sometimes based upon the view of a projection, you don't know the tip is bent or not. So the unique double marking at the tip, it can really help you with the curvature of the tip that you're looking for. This is our Expedition latest generation of endovascular robot. This is a table-mounted version with the storage car, so you can easily mount it into the table and detach and attach. It's got a sterile drape and the disposable cartridge. Dedicated cartridge for microcatheter control, and you have dedicated cartridge for micro guide wire control. It gives you all the translation forwards and backwards and rotation as well. All the things that you do with your finger, with your left hand and right hand. The surgeon or interventionalist sitting on a console and has a joysticks left for the microcatheter control for translation rotation, and a right controller for rotation translation for micro guide wire. Not only that, it's got a push button, and then inside it's got a touch button screen to control a millimeter or sub-millimeter translation rotation capability as well. That will give you the micro control that you're looking for on a delicate anatomy. With the steerable guide wire tip at the front, with the micro control capability is sitting on a console, it can give you all the micro control that you're looking for. So it's a coaxial configuration. I think there is mention of the Corundus. It's a cardiovascular robot system. It's a FDA approved, but they use what they call a side-loading rapid exchange, guide wire and a catheter. It's not really meant for neuro, but we have a truly coaxial system with the front loading or back loading for neuro, the applications that you need. So here, just to give you further detail here, our endovascular robot, you can see the guide wire, a translation is controlled and with the rotation capability. And also we have our smart electric guide wire attached, so you can constantly steer the tip of the electro steer as well. And then we have a microcatheter controller system, and also we have intermediate catheter that is also stabilized as well. So you don't have to worry about intermediate catheter buckling. So intermediate catheter, microcatheter control with the micro guide wire control mechanism all built in. So you're sitting on a console ergonomically. This currently is a cable base. Then we'll talk about 5G wireless connection for remote control as well. So we designed this for a neurovascular indication because I'm a neurosurgeon working with our neurosurgical colleagues that does a stroke thrombectomy or aneurysm coiling. But this can be used for coronary application for cardiac as well. But we are also very excited to tell you, and this can be tremendously important for target-specific chemo-imbo delivery of isolated cancers, which currently cannot be done because you don't have a capability for micro guide wire, microcatheter placement of the artery that feeding into the lesion. So we believe the way we deliver chemotherapy embolization can be extremely benefit from our microcatheter, micro guide wire capability. Also, there are some usage for embolization of the enlarged prostate. Instead of doing a transurethral TURP procedure, any embolization taking the blood supply for uterine fibroid procedure as well. So again, this microcatheter, micro guide wire steerability and the embolization or delivery system can be extremely powerful in many other areas besides neuro. I just want to thank to Dr. Professor Park and can you hear me okay?
Yes.
Okay, I'm not sure why that just popped up here. Let's see. Let me just zoom in. Can you see my slide? Can you hear me okay?
Yes.
Okay, great. With the assistance from Professor Park at a Daegu DGIMF facility, we're able to do some early feasibility work in live porcine model with a very similar setup as a real patient and using a transfemoral approach. The surgeon is sitting on a console. This case is cable-based, but we'll be also introducing to you, it's a completely wireless. using 5G system that can really connect from city to city, state to state, or transocean country to country. And this is what we are aiming for with our endovascular remote robotic system to address that 95% of ischemic stroke patients currently cannot get to the facility, has that neurointerventional capability. Again, you can see our robotic system only weighs 45 pounds, very lightweight. It can accommodate to Siemens table, to Philips table, to many other Toshiba. So it's a very lightweight system. Again, you're loading your intermediate catheter as well as microcatheter into this disposable. It's got a nice wide connector. You can introduce the injection dyes to many other the tools that you use. And with the microcatheter control system cartridge, but also your micro guide wire, you can use a off-the-shelf guide wire, or you can elect to use our electro steer with the steering capability at the front end. So this is just a preclinical feasibility live animal study. Professor Park can kind of share this with you. And we use on a porcine model due to the plexus in the neck, FDA accepts a extracranial vessels with some of the facial head and neck vessel, which has a 1 to 1.5 to 2 millimeter vessel caliber, which is very similar to requirement for cerebral vessel requirement by FDA. So this is the same model that Stryker, Microvention, or Telumo or Saya used to get their device approved. You can see we can navigate the microcatheters, micro guide wire at the on this case is targeting the some of the smaller branch of the vessels. Some of those bigger calibers up to 1.5 to 2 millimeter, but some of the smaller vessels are less than 1 millimeter internal diameter vessels. And there is really no loss of this is a very similar to your manually using your, you're currently using your left hand to right hand technique. And there's no really, relearn how to use this robot. This is coaxial system, a micro guide wire leading and the microcatheter follows to navigate through some of the branches of the vessels. It's all robotically controlled. And now, in order to show you not only navigate some of the smaller vessels, and we have to show a therapeutic, efficacy. On this case, we created autologous blood to create a thrombosis of the branch, then using a mechanical retriever or aspiration catheter to recannulate the vessel. So in this case, we took a palatine artery with intermediate catheter and micro catheter to deliver the mechanical retriever, just like the choice of your microvention or penumbra or travel by a Medtronic system or or the Stryker system or any mechanical retriever that you want to use, and you will be using very similarly. The beauty of this system is that you can stabilize your mechanical retriever and able to retrieve the micro distal catheter with the precise without a movement of the retriever. We think that that's another advantage using our system here. Again, all this is done sitting on a console to mechanical retriever to recannulate and by removing the thrombus.
교수님 시간이 좀 지나서요. 정리를 좀 해주셔야 될 것 같습니다.
네, 감사합니다. So also we done all the coiling capability. So again, the mechanical retriever of the clot, and the key that I will finish up with you is that this does everything that you are hoping to do, embolization, coiling as well. But what I want to share you one key, most important thing, just one last slide here. We are very proud to show you not only our tip actuates, it gives you real haptic feedback. and that give you a acoustic and a visual cue that you're applying a resistance at the tip. And we're the first one to demonstrate a smart guide wire with that true haptic feedback capability. So just to finish with the 3D computer image navigational system, and with all the 5G connectivity happening in the future, and now we can really do what we call remote interventional procedure. And I don't have to tell you, I saw Tucson excavator, entire procedure excavation was done in Germany, but the remote control was done in Seoul. So all this technology is all available. So what I will do is we'll stop and take any questions, is that we are literally on our guide wire about 6 months away from FDA approval. We are starting our first human case 2 weeks from now. 2 weeks from now with our robotic system. And hopefully we'll get this FDA approval within next 12 to 16 months with a large IDE trial will be happening in the United States. And I'll stop from here.
Thank you for a nice lecture. 질문나 코멘트 권호기 교수님.
Dr. Kim?
네.
Yeah. What I heard, it sounds very, very fantastic. You hear me?
네.
한글로.
Yes, I can hear you.
Okay.
영어도 해도 괜찮고 한국말도 하면 조금 대답을 하겠습니다. 네.
Yeah, what I heard is the key technology of this steerable microwire is that electroactive polymer.
Yes.
Is that right? Okay.
Yes.
Do you transfer the electricity to the end?
Yes.
To make that polymer activate, right?
Yes.
So is there a small, very thin wire inside?
It says 216-micron wire. Yes.
Okay.
There's a micron wires are integrated inside the guide wire.
Implanted through all the length of the microwire, right?
Yes, entire length, all the way to the tip. Yes.
Okay. Do you control the current or voltage or something to make a difference of the angle?
Yes. We use a less than 3 volt and a 10 milliamps. You can control the amperage and the voltage to actuate the different degree of actuation. Yes.
Okay, what I'm thinking is if you apply this technology to the larger size, for example, the endoscope or ureteroscope or bronchoscope, do you think that this technology can be applied to the other devices also?
So the electroactive polymer does not have a large force. I mean, if you want to use it for ureteroscope or colonoscopy scope or surgical robot, it does not have the force of lift that you're looking for. But it's a perfect for endovascular because there's not a lot of force required. You want a very minimal force to make those actuation. So electroactive polymer cannot be performing the heavy, artificial muscle-like.
Okay.
So it will not be the right tool for, ureteroscope, but only really good for micro guide wire or micro catheter.
I get it. 마지막 질문은 아까 최 박사님, 최 교수님하고 송 박사님 계신가요? 안 계신가? 네, 안 계신 것 같아요. 이게 do you know the controllable microcaster or wire for using the magnetic force? Have you heard about that technology? The other technology?
So, sure. In the U.S., it's called Stereotexis. Stereotexis. That's a U.S. company. They use a external magnetic but the tip is a magnetically driven with the external magnetic force.
So you believe your technology is much better than the other technology?
You know, I don't want to say what is better, what is not better. You know, I'm a practicing neurosurgeon. We're looking for practicality. What can go into the neuroangio suite and use it tomorrow? Our device is ready to go to human. We're talking about within 2 weeks, okay, 2 weeks, and get FDA approval, or even get KFDA approval. So we're looking at immediate ability to, you know, able to clinically apply is my drive. Now, the stereotexis is magnetically driven for cardiac. It's been around for 10 to 15 years in the US. But it's an enormous setup in an angio suite room with the magnetic, you know, system built into the angio suite. It can cost anywhere from $4 to $8 million. That does not include all other equipment. So I think the magnetic system has a tremendous technology capability, but to able to apply to your neurointerventional suite tomorrow, there has to be enormous amount of money that have to be invested into your suite to shield the magnetic force and able to work with your fluoro machine or, you know, anything that attracts a magnet.
Thank you. 감사합니다.
네.
네, 신영상 교수님.
Yes, I have one question. First of all, congratulations for your remarkable achievement as a spine surgeon in neuroendovascular field. One quick question is, when it comes to treat the cerebral aneurysm in very tortuous anatomy, so even with a very skillful hand, when we need some one-to-one fashion, because the wire is ahead of a catheter, and then when we overcome very tortuous anatomy, sometimes my catheter, you know, jump into the aneurysm and end up with some rupture. So, you know, I think, you know, you can control the wire only, and then microcatheter has to be followed to the steering wire. But even if there is some tortuous anatomy, and then microcatheter may jump into the aneurysm, end up with some disastrous result, right? So how can you overcome this technical, you know, like a difficulty in comes to treat endocerebral aneurysm?
In 6 months, you will see our second generation robot. We didn't show you this. It's got 4 cartridges. 4 cartridges. One dedicated cartridge for micro guide wire, one dedicated cartridge for microcatheter, one dedicated cartridge control for intermediate catheter, and third cartridge dedicated for access guide sheath or guide wire catheter. So all 3 catheter will be simultaneously controlled so that there is a you know, micro controllability of your intermediate as well as a access catheter as well. Do you follow me? I know exactly what you're asking. Okay. Right now you got only one hand. You got 2 hands. One hand controlling guide wire. One hand controlling the microcatheter. What about intermediate catheter? What about the buckling of your access catheter? I mean, so we got 3 cartridges, but same time I have shown you our tip has got a haptic feedback, and that also will give you a controllability. But if you're looking for stabilizing your microcatheter, our cartridge will constantly monitor with your fluoro and control the pre-shaped microcatheter and able to stabilize them at the neck or inside the dome. Is that what you're worried about, the motion or movement of your microcatheter?
Yes, I do understand. However, you know, theoretically, if you can control the 3 components, like wire and catheter and guiding catheter, still, I think when it comes to a very sophisticated aneurysm and small aneurysm, when you overcome the microcatheter, still it's not that enough to prevent some kind of microcatheter jumping ahead of the wire. Yeah, that's what I mean. I mean,
I think that's your technique in your hands, your know-how at the time of the real situation. But I'm giving you a tool for you to control. It's your talent. I mean, your talent's going to determine, you know, how to not to make the microcatheter not jump. But we're going to give you a tool for you to control the microcatheter from jumping.
Okay, understood. Thank you very much.
네, 감사합니다.